It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected.
Coronavirus concerns now on the minds of millions across the world, including right here in the United States, as the CDC warns of a global pandemic inching closer to a reality. Starting in Wuhan, China, the coronavirus has spread to much of the world.
Until now, health officials said they would hope to prevent community spread in the United States, but following the spread in Italy, Iran, and South Korea, health officials believe the virus may not be able to be contained, and Americans should prepare for a significant disruption. That significant disruption is where our team coverage starts tonight. Our Maggie Lohmiller gives us a look at what counties have in plan to counter the virus.
Our Joel Lopez shows us what impact the virus has on universities and their international students. But first, let's head over to TODD UNGER, who shows us what plan hospitals have in case of a coronavirus emergency.
Good evening. Yeah, the CDC has issued a set of 9 directives, or essentially best practice follow-ups, for every hospital here in the United States. At Baylor Scott, White, and Temple, that includes using face masks, it includes isolation rooms, and the staff here says they're ready. When it comes to the doctors and nurses working at Baylor Scott and White Hospital, you can never be too careful.
We use personal protective equipment, so gowns, gloves, goggles to protect the eyes.
The staff is already preparing for what doctors and nurses around the globe have already encountered, the coronavirus.
Identification is critical, and the timing with identification is critical. And so we would like the community to tell us if they've traveled anywhere that they think that they may have picked up the coronavirus.
The precautions and preparations come as the CDC says the global outbreak is moving toward a pandemic.
It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen.
One must do, try to isolate potential patients, keeping them in airborne infection rooms where they only interact with a specialized set of nurses and doctors.
Which is basically management of the air in the room. We do try to limit the amount of people that are in and out of that room because we're trying to limit the potential exposures to other people.
Only time will tell if that training is put to good use with this outbreak. Now, Baylor and Scott and White obviously operates a hospital network across the entire state, and they say any one of those facilities could likely be able to handle a suspected corona case virus. So far, no need to do that yet. We're live in Temple. TODD UNGER, 25 News.